In this episode of the Nurse Practitioner Videocast, we chat with Dr. Michelle M. Anderson, Clinical Associate Professor at Idaho State University and recent Vice President of the NPs of Idaho organization. Welcome, Dr. Anderson.
Thank you for having me.
What's it like being a nurse practitioner in Idaho? Can you describe NP practice in your state?
I'd be happy to. The interesting thing about Idaho is it's not often thought of as a trailblazing state. People don't often look at Idaho and go, those nurse practitioners are trailblazers. But I have to disagree because we totally are. Idaho was one of the first states to license NPs back in 1972. So I'm going to give you a bit of a history lesson here because I think history is so important for understanding the background of nurse practitioner practice and to fully appreciate the advocacy of how hard the NPs of the past have worked to get us to where we are today. So following that initial licensing in 1972, nurse practitioners were coming in from out of the state. They were working in our largely rural state. It continues to remain largely rural and underserved even to this day. But back in 1993, so almost 21 years after the initial licensing, there's a pretty active NP state group. And they decided to work pretty tightly alongside the Nurses Association of Idaho. And the goal at that time was to get legislative approval for the first nurse practitioner program in Idaho. The issue had been that Idaho, being largely rural and underserved, and it remains that way mostly today, was the fact that most of the NPs who were coming into the state to practice were having to be pulled into the state from other areas because there was no in-state practicing or educational program that would train them. And we found that if you have a program in the state and they're allowed to do clinical time and residency in the state, they'll typically stay in that same state often. However, our nurse practitioners we had to get from out of state. So the very first program for nurse practitioners was approved through the State Board of Education, and it started in the fall of 1993 at Idaho State University. So what a great honor for me to not only be an NP in the state, but to also be working at an institution that was the first in the state to have an NP program. That was kind of a really good forward momentum movement time. From that point, everything was geared towards moving towards full independence. And it took a bit of time, I'm not going to lie. Everything does when it comes to policy and definitely advocacy, but you can advocate all along and try to move that needle forward. In 1996, the language was changed to acknowledge advanced practice nurses into the law and not just the rules. And at that same time, an APRN advisory committee was created. Now, interestingly enough, it was an advisory committee for APRNs, but the makeup of it included 2 APRNs, but it also included 2 physicians and a pharmacist. This has changed over the years, and now it's just APRNs. But back at that point in time, we were not at full practice authority, and the physicians and the pharmacists still felt the need to be part of an advisory committee. That same year in 1996, a pediatric nurse practitioner by the name of Margaret Henbest was elected to the House of Representatives in Idaho. And if you can imagine this, she was elected by only 9 votes. But those votes matter, so always remember that. That's incredibly important. And it was great to have an advocate who was a nurse practitioner in legislation who understood the role and scope of a nurse practitioner to help educate the other legislators that were part of the House of Representatives at that time. In 1998, the Board of Nursing was moving forward again with their full practice authority concept. So they introduced legislation to introduce 4 main goals. The first was sole regulation of the APRNs by the Board of Nursing. Up until that time, it had also been monitored by the Board of Medicine. They wanted to define into law the 4 categories of the APRNs. So that would be your certified nurse specialists, your certified nurse midwives, your CRNAs, as well as your certified nurse practitioners. And then the last was to give full prescriptive and dispensing authority for Legend and Schedule 2 to 5 drugs. Also important as part of this was the fact that they also introduced language to remove physician supervision to replace by words such as collaboration and consultation. That was not a popular choice, and that caused a lot of angst, but these rules were subsequently approved in 1999. But there were a lot of battle scars that came with all those changes, those 4 legislation goals that were proposed, and then that language changed. So come 2003, the nurse practitioners decided they were ready to take up the fight yet again. Once again, always moving that needle forward to full practice authority concept. They decided to dip their toes back in the water with a full push at that point in time. We still had our House representative, Margaret Henbest, who was that pediatric nurse practitioner, but we also had a senator who was a family nurse practitioner by the name of Sheila Sorensen. Fabulous ladies, these 2 are. But because we had a representative in the legislation, and we also had one in the Senate, we were able to have them co-sponsor this legislation for full practice authority. Interestingly enough, Sheila Sorensen was also one of those first 10 NPs licensed back in 1972. When I started the history story, she was one of those first NPs licensed back then. And so it's pretty interesting to see how that came from 1972 full circle to her being a senator and then being able to co-sponsor language to move forward full practice authority. They were successful. Nurse Practitioners Group of Idaho worked diligently. They worked incredibly hard. They gathered all their resources. They got all the support they could. They got all their stakeholders involved, and they were able to move that needle all the way forward. So on March 23rd, 2004, Governor Kemp Thorne signed House Bill 659 into law, eliminating the requirement for physician supervision of nurse practitioners, clinical nurse specialists, and nurse midwives. Hence, we got full practice authority. This was literally 32 years after the first licensing law for nurse practitioners back in 72. So it took a few years, but the needle moved forward, and it was an amazing thing. And we were one of the original states to ever have full practice authority. So I think there's quite a few trailblazers in that story. Now we have over 1,900 nurse practitioners in our state, and we have 5 American Association Nurse Practitioner Fellows. We've got Dr. Randall Hudspeth, Dr. Kathy Arvidsson, Dr. Lorna Schumann, myself, and our most recent fellow inducted last year was Dr. Melody Weaver. Of these practicing nurse practitioners, we have been able to increase our rural workforce by 34% in the last 2 years. That's amazing and so important in such an underserved area. We now provide nearly half of primary care in Idaho, and I think that's amazing. We always talk about the value of NPs and how we can really increase access to care, and I think our state shows it quite beautifully. There's actually 7 communities in Idaho that rely solely on a nurse practitioner for their access to healthcare. So that's a little bit about practice in Idaho and what I think of are some amazing trailblazers and some amazing policy and advocacy moments in the state.
How has your personal NP journey been so far?
Thank you for that question. I have been a nurse practitioner, I always say forever, but it's not been quite forever. It just feels that way sometimes because I've seen so many changes. I started out in 2001, and I received my Master's of Nursing and my Family Nurse Practitioner Certificate from Duke University. So I found myself initially working in North Carolina, which if anybody follows the practice authority in states, North Carolina is very much a red state. They require physician oversight into practice and collaboration for sure. And when I was first licensed there, I was licensed duly under the Board of Medicine as well as the Board of Nursing. And I could be wrong, but I think that part has changed since then. And now it's just Board of Nursing. But when I first graduated, I worked as an acute care hospitalist in North Carolina for a couple years, and then I followed that by 4 years of inpatient and outpatient cardiology. Phenomenal experiences. I'd initially been an emergency room nurse, so those were great and in my wheelhouse, but that really set me up for where my journey took me from that point. I moved in 2007 with my husband to northern Idaho, and I went from a red state to a green state. And I don't even think I fully appreciated what that would look like at that time. But man, do you open your eyes when you start to see, like, wait, I can just do this. Nobody has to tell me it's okay for me to do this. I just have to practice within my scope and my role. This is wonderful. And interesting, I went from working with physicians in specialty, which they were amazing mentors for sure, to working with a nurse practitioner in her own Medi-Spa clinic. And that's really got my eyes open to what nurse practitioners can do when they do have full scope of practice. I could see what she was able to do with running her business.
Can you discuss your NP subspecialty a bit more?
Shortly after that, or I'd say about a couple years after that, I'd had my son and I kind of wanted to change what my practice looked like. And so I was able to start my own practice. Now, keep in mind, that was not an easy choice. I was unsure of what I wanted to do. I was in a rural area, so my choices were limited for what I could do. But my husband was a chiropractor at that time. And when they go to school, they are completely trained in the business model. They know how to open a business, run a business. And he just looked at me and said, Michelle, start your own business. You've got this. I'll help you. And what a great mentor he was. I also utilized Small Business Association of Idaho. I got a business mentor from there, and I was able to take some courses online and just get a really good feel for what business would mean, because we're just not trained that way. And I'm trying to make differences like that in my educational role now, so that nobody leaves school with that same feeling of not being adequately trained. And you may not feel fully adequately trained, but I at least want people to have an idea of what owning a business looks like and how you have to think not only as a nurse practitioner and a provider, but also as a business person. So I was able to open my own practice in 2009. And a funny story is literally the same week I opened my practice, I found out I was having my second child. Completely unexpected, a pleasant surprise. I'm not going to lie. It was a lovely surprise, but it was unexpected. I'm like, wow, I'm going to do a whole bunch of things all at once. And let's just do this. What a ride. So I created a business plan. And it's probably the biggest thing I took away from my mentor and the Small Business Association was the importance and relevance of creating a business plan. It allows you to formulate all your thoughts and ideas. You put down your mission, your values, your goals. You can create your business around what you need it to look like. And then you have to look at what your competitive avenues are. What other practices in the area are you competing against? What will you offer that they don't? What's going to be different about your practice? How are you going to manage that differently? You have to look at your strengths and your weaknesses. And one of the things I would say strongly is play to your strengths. So my strength is healthcare, patient care, and looking after people in my community. What my strengths weren't necessarily were bookkeeping and accounting and billing. So I brought in a good biller. I learned how to code really well, but I brought in a really good biller. I brought in a fabulous accountant, and then I brought in a separate bookkeeper. And sometimes people ask, why did you have a separate accountant and separate from a bookkeeper? Because they kind of check each other. It's a business thing. I just wanted them to check each other, so I never had to worry about one person was doing versus another. Everybody had to make everything line up. And I knew that wasn't my strength, so I had to play to my strengths, and I chose them to fill my weak areas. And it was a fabulous plan and idea. It was incredibly successful. I was able to build my practice. And over the years that I had it, I ended up with a patient volume of right about 2,500 patients. But separate from that, they were an amazing population of people in rural northern Idaho. They were wonderful to take care of and to be part of their lives. And then when you work in rural practice, that's what it is. They become a part of your family, because it's not like you can go someplace and not run into somebody you know. So you really embed yourself into a community when you do a rural practice. And I think it's important to take part and engage directly into that community as well. I was a medical coordinator for a half marathon in the county, and I held that position for many years. I also was able to be the president of a nonprofit cancer organization. This allowed me an ability to participate in a different way. So as opposed to just telling a patient that perhaps they had cancer, I was also able to participate in a nonprofit organization that helped them in a different way. So it felt a little bit less helpless sometimes when you give that information, if you can help in a different way to support them. Interestingly enough, I eventually went back to school and got my doctorate of nursing practice. So when I graduated in 2001, DNP was not a degree, and I didn't necessarily have an interest in a research PhD. So when they created the DNP, I knew then that I'd one day go back to school. I just was waiting for the time. So I had my own practice. I had 2 children. They were 3 and 4 at the time. They're only 15 months apart. And I thought, this is the right time. I know, crazy, right? My husband was a great support. He still is. And I ended up going back to Idaho State University, not back to Idaho State, but to Idaho State University. And I was part of one of their first graduates out of their DNP program. So not only were they the first state to have an NP, the first program in the state to have an NP program, but they were also the first ones to graduate a doctorate of nursing practice. So what an honor to be part of that history. And they always say that, I was a clinical, I already had my master's, I was already practicing, I'd been an NP for a long time. What was the benefit of that doctorate? All I can tell you is it had a benefit. The leadership and the further information it gave me have proven themselves over and over again. I don't think I fully understood it at the time, but within, I'd say, 1 month of graduation, I was approached by our local CEO of our hospital and asked to be on the county hospital board of directors of that hospital. What an honor. I was the first nurse and nurse practitioner to hold that position, and it was a leadership position, and it allowed me the opportunity to talk about the scope and practice of nurse practitioners in an organization that was in the process of making some changes in what healthcare looked like and introducing nurse practitioners into their acute care setting and then to their immediate care setting and different areas like that. And I was able to be an advocate for that role. I was also approached by a nurse leader of Idaho and asked if I would have an interest in sitting on a committee that's called the Idaho Healthcare Coalition. So I was able to be appointed by the governor to that coalition, and I was also the sole nursing representative on that group. And it was created to implement the state healthcare innovation plan and to develop a patient-centered model of care. The focus of that was to improve population health and improve individual health outcomes and cost efficiencies. And being a provider in northern rural Idaho, I couldn't think of a better place for me to sit. You definitely want to take opportunities when you're called to the table to take your seat at that table. And that was a fabulous opportunity to meet other people in other areas of the state who has similar interests and move that plan forward. So that was wonderful. I also precepted students a lot in my practice. It was still at that time, and I think it still continues to be, a little bit unusual for a nurse practitioner to have their own clinic solely. And I often had students come and want to precept with me so they could get that full experience. And it was during that time when I was precepting a student, I believe it was 2019, when they asked me why I wasn't teaching at a university level. I'm like, well, because I teach in here. They're like, but you could teach so much more. You could do so much more if you could teach at the university and teach everybody this type of business and this type of model and this type of care. And it got me thinking. And it wasn't long before I thought that might be a really neat idea. I mean, the really great thing about being a nurse and a nurse practitioner is you can always reinvent yourself. You can always move forward. You can always make a change. You can always pivot. And I think that's so important. It's important in policy, it's important in advocacy, but it's important in healthcare because things are constantly changing and you want to grow with that. So I reached out to my colleagues at ISU and said, and I had already been teaching adjunctly for them, I said, hey, if an opportunity for a full-time position ever opens up, please reach out and let me know. It wasn't but 3 or 4 months later that that opportunity presented itself. And so I talked to my husband and children about the idea, and they were incredibly supportive. And it wasn't an easy idea to make because, you know, we had to sell my practice. We had to sell my husband's chiropractic practice. And my children had to leave the only friends they'd ever known. But we were all supportive of the concept. So we had to move from northern Idaho to southern Idaho, and we made the change. If you want to add a little bit of stress and interest to that concept, add COVID, because that's what was happening when this change had to happen. We bought our house online without ever seeing it and just had to go on a wing and a prayer. And we moved down here. An interesting story. The house we bought was 8 houses away from the program director, and we became great friends, and it couldn't have worked out any better. It was just an amazing coincidence, and it's been nothing but wonderful since. My husband decided to make a midlife change, and he became a nurse, and he's now in school to become a psychiatric nurse practitioner. And my children are doing well in school, and they've really appreciated the change and their ability to grow in their subsequent sports and what they've done. So truly, we flourished with the change, and it could have gone so many different ways. It wasn't an easy choice to make because I had patients that were family. I talked about working in rural healthcare, and it truly is having family. It is like having an extended family. You become part of that. You have 4-generation families. You have patients you've taken care of where you've been the only healthcare provider. So the choice was not made lightly. I'm going to say that. I was able to sell my practice, so my patients did not go without access to a provider, and they've had great care since. So I just want to say that was probably, out of everything, the hardest choice to make was saying goodbye to the patients, because they really become embedded in your soul and still are. I still talk to a lot of them. I still reach out whenever I go up there. There's a lot of people we still connect with when we go up. So, but coming down and becoming a faculty member was amazing because I was able to utilize some different skills. I could teach, but I also could participate in things that were a little more difficult to do from northern Idaho. I had the opportunity for professional growth. I had access to different resources. And the close engagement with colleagues and mentors right here in the office was amazing. I've been able to increase my advocacy knowledge and participation. A side note is, who would have thought that when I start a second practice, I don't know if I would have ever thought that, but because I had that history, the faculty was at a point where they were ready to start a faculty-led practice. And I was able to lead that along with some amazing colleagues of mine and utilize my business acumen to create a faculty-run practice here. And we have that up and running. I'm the current medical director of that clinic. And we see people from the community, we see faculty and staff, and just this year we took on the student health contract. So once again, I was able to start another business in such a slightly different way that is a different focus with different barriers and different learning curves. And it's always fascinating. The great thing about the practice here is it's multidisciplinary. So I have access to pharmacology. I have access to integrative mental health. We have access to physical therapy. It's a great little cohesive group in our clinic. And it's wonderful to build something new again. And it was just from a different way. I didn't think I would do that again. And it was amazing to do that. When you look at advocacy and the opportunity to grow and change, I was recently appointed by Governor Little to the State Board of Nursing here, and I'm the APRN member. So if you remember talking about history, and back in 1998, how the Board of Nursing introduced language to the legislation that included a designation of an APRN to the State Board of Nursing, I now get to hold that role. So once again, to see history come all the way back around and to be able to take a part of history by sitting in that position that was created back then is just so super cool. So I think I'm blessed, and I have a wonderful family who's very supportive and amazing colleagues.
Have there been any roadblocks you've dealt with or advocacy issues you're passionate about?
That's such a great question, because I can tell you straight up, you can't get anywhere in life without coming upon some roadblocks. And I think part of that is how you manage those roadblocks is where you can go with it. I'm going to talk about one with my business first, and then I'm going to talk about an advocacy issue that I think is so incredibly important, because I think they sort of work together, and the one created my passion for the other. So when I was having my own practice, I talked to you earlier about how sometimes I was the only person who'd ever taken care of patients. Well, one of my biggest patient populations were teachers and teachers' families and their children and their spouses. And what ended up happening was the union for the teachers had inadvertently signed their whole health policy care, their whole insurance network in with a physician-owned network. And that physician-owned insurance network or healthcare network did not allow it. It excluded nurse practitioners from being able to credential into that network or see those patients. Well, in a rural community, when you take away one of the bigger populations that is coming to your clinic, that is difficult from a financial standpoint, but separate from that is the emotional issues that it entails. You've got patients who don't want to go anywhere else. You've got families who only want to see you. They don't want to go to the other practices. But because it's not an affluent area, they have to go where their insurance dictates. So myself and two other independent nurse practitioners approached the CEO of this physician-owned health network to see what that would look like. How can we get credentialed in that network so we can continue to see the patients that we were seeing? We didn't need more. We just wanted to see the ones we were already seeing. And we had a meeting with the CEO, and to say that he was pleasant, but almost in a tap you on the head kind of pleasant. You sweet nurse practitioners, it's so very nice that you care about your patients so much, but we're also very sorry that we are not going to credential you. Interestingly enough, they would credential nurse practitioners who were attached with a physician group, but they would not credential independent NPs. So we were unsure where to go after that. Nobody likes to be tapped on their head when they're an adult, per se. So we thought we were going to see what this looked like. Who else was affected by this same policy? So we reached out and we found some independent surgical centers that were also impacted by this. And we're like, let's get together and see what we can do. This is that grassroots advocacy. And this was all new. I mean, you learn a little bit about health policy and advocacy in school. You don't always have the opportunity to play a part in it or necessarily to have such a great part in it. And this was learning on the run because it had been a few years since I'd been in school. This was before I went back and got my doctorate of nursing practice. So I hadn't had an opportunity to relearn health policy. So we had our patients reach out to the state insurance organization because they don't represent us, they represent the patients. So we were able to get some feedback from there. The physician-owned healthcare network was a network off of Blue Cross, is who they work through. So we're able to reach out to Blue Cross to see what that looked like and what we needed to do there. And we were able to reach out to our Nurse Practitioners of Idaho organization to see what they could offer to help us. So here we are up in northern Idaho. We had a bit of a disconnect from the south, but we thought we're going to reach out and see how they can help us. And just so you know, organizations are there to help everybody in the state. Sometimes you may not feel that, but they're there for everybody. And I think this is incredibly important because they were there for us. They never met us. They didn't know us. I don't even necessarily know if we were members at that time, but they were willing to help us. They put us in contact with the state liaison for AANP as well as the region director for the same AANP. And those two people, along with the state organization, were able to move our concerns up the chain. They were able to give us some guidance on things that we could try and do in the area, such as creating greater stakeholders, getting a bigger momentum behind us, getting it known out to the community what we were looking to do and what was going on. And we were able to get all the way up to the national organization. And I'll always remember this. If you're ever a health policy person, Jan Towers to me it's a fangirl moment when I was able to talk to her on the phone and have her guide us in what it would look like and what she recommended we do next. And then as she was getting off the phone, and she says, oh, and just so you know, my next meeting today is with the FTC, and they're very interested in the outcome of your area and what's going on. And I'm like, oh, very interesting. And usually these processes sometimes can take a period of time, but within 6 months I was at a local ball, and a colleague of mine walked up to me and tapped me on the shoulder, and she said, Michelle, you guys won. And I was at a ball, so I wasn't sure if I'd won an auction item or if I'd won something different. She goes, no, you guys won your battle against a physician-owned network, and the CEO has been fired, and Blue Cross has taken back that group of patients that were previously insured by them. We found out later that that network lost over 13,000 members with the change we made, and Blue Cross took them back. We got our patients back. We were able to continue to be credentialed. And it's like, I think the best David and Goliath story when it comes to policy and advocacy and things working out, because so many times you feel it can go in a different direction. But it really made a difference. We were doing it from our hearts for the right reasons, and then we were able to reach out and get people to help support us during that journey. So if I can say anything about the importance of roadblocks is determine who can help you. Don't do a roadblock alone, because sometimes that's almost impossible. Always reach out to see who can help you over it. There's always somebody who maybe has walked in that path ahead of you or has walked in a similar path who can reach out and tell you how to navigate what that will look like so it's not so dark and scary. Now, that's a fun David and Goliath story, but from an advocacy issue, I want to talk about something amazing the Nurse Practitioners of Idaho have done just recently. The state organization had been working really hard to get a preceptor tax credit in place. As an educational institution, we're always looking for preceptors for our students. It's incredibly important for students to have on-the-job training, incredibly important for preceptors to do that clinical work. So hard. But then you get to competing with lots of other organizations. There's other state organizations or other state universities that have nurse practitioner programs. You compete sometimes with physician assistants for those placements, and we have an ICOM or a DO program locally that also is competing for site placements. And some of the private programs, such as the ICOM group and a private university locally, are able to pay preceptors, but state institutions cannot. And so you're losing sites, and it's incredibly important because we have an underserved area. We're trying to get our students out there. We're trying to get students through the program, but some of the inhibiting factors of taking students into programs is you have to still be able to place them into the community to get those clinical site rotations. And we're finding some roadblocks or barriers to that. So we were looking at ways from the state organization to try to overcome what that would look like. And one of those had been a preceptor tax credit. Other states have done that, some successfully, some are still working on it, some are revamping it, some are changing it, but there's been other states that have done that. We're just looking for our way to do that. Idaho legislation is not a big fan of tax credits for the most part, and we were having a hard time getting that moved forward. So once again, you have to pivot, right? You want to find another way to get to the same end result. And Nurse Practitioners of Idaho currently has a really great lobbyist who is able to reach out to the Workforce Development Council of Idaho. It's a state group. And they had some grant funding left over from COVID that had to do with enhancing workforce. And we were able to create a program within that, similar to one they already had going, that allowed for us to pay our preceptors through this grant. Now, it's a pilot program, and they were collecting data through that, and we were able to also include physician assistants, pharmacists, and prescribing psychologists, as well as nurse practitioners into that program. We were able to get a match from Blue Cross, and with that grant money, we're going to see if that incentive, that ability to reimburse preceptors for their valuable time, if it changes anything, if it allows for increased accessibility to preceptors, increased volume of preceptors, that's what we're looking for. With the end goal that if that is what that data will show, is that we can move forward with possibly a budget line item that will be continuously there going forward to support preceptors moving forward and our students who will be providers in the near future. So that's kind of a fun advocacy thing we've been working on for a couple of years that's moving in a really great direction. And it's actually kind of unique because we talked at the very beginning about Idaho being trailblazers. We're the first state that's had the ability to put a program in place like that and do a pilot program like this to collect the data. So I think that's amazing. And a lot of that goes to the legislative committee who works with the Nurse Practitioners of Idaho and their lobbyists who work so hard for that. So I think that's a great kudo to our state.
Is there anything else you'd like to discuss?
I think if I was to say anything else today, because I think I've talked quite a bit already, it's just to stay active within your state and your profession. Advocacy can be whatever you make of it. If you'd asked me in 2001 when I graduated what advocacy type stuff I'd been doing, I probably would have been, I don't know, if anything. But you can do so many things. If you don't feel the need to engage on a bigger level, then just support your state and national organizations through membership. By being part of those organizations, their strength is bigger because they speak for greater volume. And they're going to do the work for you, whether you're part of them or not, because that's just the nature of how you do when you work on something. But if you can support them by being part of those organizations, when they speak, they're able to say, I speak for this many people. And that's such a strong place to come from because we are always stronger when we work together.
Thanks so much for your time today, Dr. Anderson.
Thank you for having me.